And Dr. Bosire, as a frontline worker, we first celebrate you for what you're doing for us and on our behalf. And what is your feeling even as you face this pandemic in the current circumstances that have been put across by other health workers?
To be really honest, I am anxious, and my anxiety just is reflected across the board. I am tired. I am heartbroken that this over the weekend we have lost yet another healthcare worker who has just delivered a newborn. Marianne, she's a nurse in Homa Bay, and I don't think the gravity of COVID has really hit home until when we lost Adisia. When we kept saying that protect us, the only way you can protect me as your doctor is to be able to ensure that you're safe. It's only now that it's hitting home that even those of us who have been tasked to be able to keep you alive on ventilation, on medication, to ensure that even when you are critically ill, we are there until we start dropping, until we get isolated. As you've seen, the last 1 week we've had some of our senior colleagues being isolated. That's when the reality is hitting. And even when this reality is hitting home, we think very little investment in protecting us, to be very honest, right? We've been thinking about PPE since February, since March. We're still thinking about PPEs until now. It breaks my heart every single day to read headlines where there is misappropriation of resources for COVID. There is PPEs that were supposed to get to frontline healthcare workers never got to frontline healthcare workers. It became a business for individuals, and then you still expect me to show up as your doctor. How? And yet I'm bound to doing no harm to you. I'm bound to ensure that I preserve life. And yet I'm human still. I am a mother, I'm a sister, I'm a member of the society, and my community still needs me. How am I supposed to do my work when I cannot do my work well because I'm unprotected? So anxious. I'm an anxious doctor on behalf of the other healthcare workers also.
Okay, now, Dr. Bosire, we hear you and feel your pain, and I am sure you speak on behalf of very many others that wake up every day to cater for Kenyans at large. And Lois, just listening to Dr. Bosire, I mean, at this point, I think it is very clear for those that have forgotten that doctors, nurses, other, healthcare workers are just as human as we are.
Yeah, I think Gladys, Dr. Bosire is raising a very, very critical concern. And as I'm part of what we call the debriefing of healthcare workers. And actually it overwhelms. It even overwhelms us as the people who are supporting them emotionally. And you can hear the pain and also the reason why they are actually being put, their vulnerability is dependent on some selfish, somebody who is not taking care or taking responsibility. And that's a fact. And some of these things now, we've just got to be candid about them. Because, you see, if you're not protecting someone who is literally, like what Dr. Bosire is saying, they are literally walking into the valley of death. But there's a way in which they can protect themselves to reduce the anxiety. So most of the healthcare workers are overwhelmed. Remember, they are coming from those hospitals and they also have families.
Yes.
And these families are also anxious. We're already handling even children who are almost afraid. It's like they see their mother, they see death. They see their dad coming from hospital, they see that. So a child develops again now a panic disorder simply because this person is putting their life on the line to be able to save someone and to be able to work according to what the oath that they have taken. So I think the situation is extremely critical. But then what really concerns me as a psychologist and also as a spiritual person is the lightness, the carefreeness with which we are taking, this whole scenario. Because it's a simple thing that we are supposed to do, but then most of us are taking it just for granted. Yeah. if we were to do something greater than a mask, than social distancing, than washing hands, you know, we would say it's costly. But now it's something that each one of us can be able to do. I usually say the soap does not matter. The quality does not matter. Soap is soap. So we are still a bit carefree. And when you watch people talking about it, I mean, Kenya, it's good, it's humor, gives us a way of coping. But when we take it overboard, when we need to take personal responsibility, then we are really endangering some people's lives.
Okay, yeah. And just to drive this point home, Dr. Chibanzi Mwachonda, the Acting Secretary General of the Kenya Medical Practitioners, Pharmacists and Dentists Union, KMPDU, tested positive for coronavirus last week, and he is currently stable and in self-isolation. And this is just another case that brings to the fore that our health workers are also as vulnerable as you are. Dr. Bosire, back to you again. Lois has talked about coping mechanisms despite and in spite of everything. How are you coping with your reality?
So one of the things I'm really grateful for is my social support system. I'm really grateful for my girlfriends. I'm really grateful for my family because, like this week, they've taken TJ, my son, away from me. So I am going to spend a lot of the time just introspecting and thinking about lots of things that are happening around me. I am also dancing, right? Something I haven't done in such a long time. I am discovering, like, you know what, I can be able to find other means and ways of just forgetting that I'm a doctor and just bringing the life out of me. And the other ways in which we are trying to also build social networks within my support system, who are my colleagues. So we constantly check on each other. We are Zooming, we are WhatsApping. I think this is the most I've ever been on social media for a long period of time because I keep checking on what's happening beyond medicine, what's happening outside there in the world, because then it keeps us sane. The other thing also, as we are also debriefing, and the Kenya Medical Association, together with other partners, have put up this fund to be able to support healthcare workers in debriefing. We have psychologists on board. We're working with the Association of Psychologists, and it's really, really helping us a lot. Despite that, we are trying to survive. I mean, this is actually moments of survival, and but the biggest and the most important thing is that we are grateful for the Kenyans who are doing what they can be able to do to keep us safe. Despite the fact that we are saying a bigger number is not doing, a huge number is not really focusing on the public health interventions, we appreciate those ones who are keeping to the latter, the public health interventions that the government keeps speaking about: social distancing, hand hygiene, even those who are taking vitamin C. We are really grateful for that, and we are encouraging that. In fact, a colleague of mine and I have been really advocating through the hashtag The Cure to be able to ensure that people are able to become their first physician, so that by the time you're brought to me, can you be brought to me when you're critically ill or when you cannot be able to take care of yourself at home? So we are encouraging home-based care. We are encouraging people to be able to see doctors or nurses from their comfort of their home, so that there's very little interactions with the rest of the public, and there's a reduction in the risk. And Gladys, this is a reality also that we have to live in. And the reality is around what is this COVID teaching us right now? And as a healthcare doctor, one of the things, aside from seeing COVID patients, the other reality for me is the neglection of the other diseases that are happening. I mean, we still have our hypertensive patients, we still have our diabetic patients, still have our asthmatic patients. And because of the fear and the stigma around COVID, which we must also deconstruct, because while it's a dangerous disease, it's fatal, we have to tell the public that 90% of the people are walking out alive, 90% of people are surviving.